today, let's talk about how ARTESIA study indicates Apixaban reduces stroke risk but increases bleeding in subclinical atrial fibrillation. A new meta-analysis of the two trials showed that oral anticoagulation with edoxaban or apixaban reduces the risk of ischemic stroke by approximately one third and increases major bleeding by roughly double. A new meta analysis of the two trials showed that oral anticoagulation with edoxaban or apixaban reduces the risk of ischemic stroke by approximately one third and increases major bleeding by roughly double. In absolute numbers, there were 3 fewer ischemic strokes per 1,000 patient years with anticoagulation in the two trials combined at the cost of 7 more major bleeds. In patients with pacemakers or implantable loop recorders with continuous monitoring, subclinical atrial fibrillation is detected in about one third of patients. The totality of risk factors in each patient was their bleeding risk, stroke risk, how much atrial fibrillation they have, and make a decision as to whether to give anticoagulation or not. Coming to the results, both trials showed the stroke rate is low in these patients, about 1% per year, and that anticoagulation can reduce it a bit further at the expense of increasing major bleeding. The atrial fibrillation episodes picked up on these devices constitute a sufficient stroke risk to warrant anticoagulation given the bleeding risk.